All right, let's get started. Hello, everyone. Good afternoon. Thanks for joining us today to hear from Vault Workforce Screening about marijuana legalization and employer drug screening policies and practices. We're so glad you're here today. I'm going to talk very briefly about the MSP Wellness Initiative of the Minneapolis Regional Chamber, and then we'll get right to the subject matter and turn it over to Sean from Vault. We'll go ahead and move to our first slide, Amy. First of all, my name is Frances Huntley. I am the Strategic Partnership Program Manager at the Minneapolis Regional Chamber. I lead the Chamber's MSP Wellness Initiative, which is a partnership between the Minneapolis Regional Chamber, the Hennepin County and Minneapolis Health Departments, and health partners. We are all working together to provide tools, resources, and programming for employers to help them support employee wellness and cultivate a culture of health and well-being in the workplace. We'll move to the next slide. We have a couple programs that we offer through the MSP Wellness Initiative that I'll talk about very briefly. And we're also offering lots of new programming through the initiative this year. Our next program will be in October 19th. It'll be in conjunction with the Alzheimer's Association, talking about supporting caregivers and those who may be impacted by Alzheimer's in the workplace. So lots of educational programming coming this year. You can register for that and get all the latest updates at mspwellness.com. The first and most well-known program we offer through MSP Wellness is the Champion Designation Program, which is our recognition program for businesses and organizations in Minnesota who have developed employee wellness programs and are doing great work in the employee well-being space. The only thing you have to do to qualify your organization to be an MSP Wellness Champion is go to mspwellness.com/champions and fill out a one-time application. And if you qualify, you receive a number of promotional and recognition benefits throughout the year, and particularly at our annual celebration event, which is November 8th. So please consider applying if your organization has an employee wellness or well-being program and is actively doing that work. We'd love to have you as a 2023 MSP Wellness Champion. We're coming right up to the deadline for recognition at the end of next week. And the last thing I'll share with you on the next slide is our Minneapolis Microgrant Program. This is done in collaboration with the City of Minneapolis. We administer grants from the Minnesota Statewide Health Improvement Program, or SHIP, to businesses in Minneapolis to implement projects focused on changing workplace policies, systems, and environments to support employee wellness. The microgrants are really designed to be a catalyst for organizations who are just starting on their workplace wellness journey. And we have this great group of 12 organizations that you see on the screen doing that work this year. And we'll open applications back up in January of next year. If anyone's interested or you know of a small business who may be interested, feel free to pass that information along. It can be found at mspwellness.com. All right, so now what you're all here for today, we've partnered up with our friends at Vault Workforce Screening to offer this program and hopefully more in the future, and also to offer Vault services at a discounted rate through a new affinity program. We're so grateful to be working with Sean and all the great folks at Vault. Please reach out to me or Sean if you have any questions about that or about Vault services after today. I'll go ahead and introduce Sean O'Neill and let him get right to the subject matter here. Sean is Vault's Compliance and Privacy Officer. He's a well-known and respected name in the industry, having over 20 years experience in leading consumer privacy, regulatory and legal compliance, driver safety and recruiting, customer operations, training, data analysis, and process design, creating more effective customer and operational solutions. Sean, thanks for being here today. I will turn it over to you.
Great, thanks for having me. All right, let's go ahead and share my screen here and we'll jump right in. All right, so today we're here to talk about changes that are going on at the state level with regard to marijuana laws and how it impacts employers from a testing perspective. So just a little bit about Vault. We are a full service third-party administrator and consumer reporting agency. The services that we provide and specialize in are drug and alcohol testing, both for federally regulated employers as well as employers who want to have their own policy on drug testing. We do provide full suite of background screening, which would include motor vehicle reports, criminal histories, items that are required, for federal agencies like the FMCSA clearinghouse and the FAA pilot records database. We do provide also occupational health services, recovery monitoring services. We are a direct provider of medical review officers. So we do employ our medical review officers directly and make them available to our clients. So jumping in, let's talk about what's going on with drug testing. One of the questions I'm always asked when I first start talking to a group about drug testing is, should I continue to drug test? Coming out of the pandemic, our workforce methodology has changed. We've gone to a lot of hybrid and remote workforces. And so the question is, should I continue to drug test? And there have been a number of studies that have been conducted that I believe indicate that drug testing hasn't gotten, or drug use hasn't improved from the pandemic. It's actually gotten worse and is a risk for all employers. In a number of surveys that were done, employees admitted, 20% of employees surveyed admitted that working from home is a benefit for them because they are able to use drugs and alcohol while they're actually during business hours. And 73% of the participants said they actually see it as a benefit. They wouldn't want to return to the office because of the availability and flexibility that they have with using, drugs, alcohol, and other substances, while they're on the clock. In another survey that was conducted, 22% of those surveyed admitted that being on a Zoom call, like we all are here today, they've actually attended those while impaired or under the influence of an illegal substance or alcohol. And what was fascinating is 21% of those surveyed said, yeah, I know my coworkers sometimes show up impaired. I can tell. So the remote and hybrid workforce is actually complicated, drug use in the workplace, and actually is a reason why employers should still consider drug testing their workforce. And then, coming, out of the pandemic in May of 2021, a survey, found that Americans, 1/3 of Americans reported they increased their alcohol consumption, and 29% of drug users reported they increased their drug use. So we've got the opportunity for, employees to use at home or hybrid or even on the job site. And just overall, we're seeing, a near 30% increase in just self-reported use. And this has a cost to employers. The annual estimate right now is that for an employer, for an employee who has an untreated substance use disorder, the annual cost of that to the employer starts at about $9,000 and can ratchet up based on, the risk exposure, if it's safety sensitive versus non-safety sensitive. So, there is a case to be made that drug testing is still important today, more so than ever. So let's talk about what's going on. We're going to talk about what's happened in the state of Minnesota, but Minnesota is not the only state that has made some changes this year with regard to cannabis or marijuana. So let's start with Kentucky. In March of 2023, Kentucky passed their medical marijuana law. So, if you're an employer who has employees in the state of Minnesota, but you also have employees outside of the state working in states like Kentucky or California or Washington, you need to stay current on what's happening outside of Minnesota because those laws may apply to you as well. So Kentucky passed their medical marijuana in March of 2023. That was followed a month later by Delaware passing their recreational marijuana law, which came in April. Then, as we all know, Minnesota passed their recreational marijuana law in May of 2023. Minnesota has had, medical marijuana, for a number of years and was one of the first states that did have, medical marijuana available. We did have, a partial passage, last summer of edible and drinkable THC being made available. And now in May, full recreational marijuana has been passed. Uh, Within that passage, um, there are some laws that go into place as of August of this year, so they're already in place with regard to employment testing. And we're going to go into that in more detail. Uh, on the horizon for employers, if you have employees who do work in or travel through the states of California and Washington, their employment laws are also changing here in the near future with regard to drug testing. Both of these states are making it more challenging for employers to test in the states of California and Washington. Um, so what does it look like from, a country map standpoint? So Minnesota became the 23rd state to pass recreational marijuana. So you can see here from this map, the dark green states, those are the states where, marijuana is fully legal for recreational use. You then have another group of states, kind of that, lighter shade of green, that have passed medical marijuana, but they haven't moved into the full recreational space. So you have a handful of states where there is an infrastructure for, citizens to obtain marijuana for medical purposes. You then have another group of states, the lighter green here, where they have laws in place on low THC usage. So these are states where for example, they may have a law that childhood seizures can be treated with THC oil. Very prescriptive, very narrow. We're not talking the infrastructure like we see in other medical states where there's dispensaries that are established, and anyone with a medical card can go and obtain marijuana or cannabis products. These are states where it's very prescriptive, or CBD is allowed. And then we still have three states, basically, whose laws make the use of cannabis products still illegal. And then we do have a handful of territories and locations like Washington, D.C. that also have passed some type of law, whether it's fully recreational or medical marijuana. What I find fascinating is taking the map and taking the states and comparing that to the US Census data. We're at a tipping point here. 50% of the US population resides in a state where marijuana is now fully legal. And so that is posing a challenge for employers, because at the federal level, marijuana is still considered a Schedule I drug. So nothing changes in federal drug testing. Marijuana is still a Schedule I drug. If you're in a regulated industry like FMCSA or FAA, you still have to test for marijuana and take action on a positive drug test result. But if you're not governed by a federal agency like that, now you have to understand what's going on in the states that you're testing in. Can you test for it, and so forth. And we're going to talk more about how do you decide how to adjust your drug testing program if you're in those states, like the state of Minnesota. If you look at then adding in the middle states, you're now at 74% of the US population has some legal access to marijuana, whether it's medical or recreational. So we're now talking 3/4 of the US population, which leaves 24%, in those states that allow CBD or low THC products, and only 2% of the population, in one of those three states where it's really still illegal on all fronts. So this is causing, significant challenges for employers managing, when they have employees that are located in multiple states. So let's spend some time talking about what went into place in August of this year for Minnesota. So a number of things have changed for employment testing in the state of Minnesota. The first is within the law that was passed legalizing recreational marijuana, the law basically states now that cannabis can no longer be classified as a drug. So, in the definition of drug within the state of Minnesota, cannabis products have been removed. And this is important. And this is where words really matter when you start taking a look at these different laws that are being passed with regard to marijuana testing. What this means for employers is if you're an employer that can still test for cannabis products in the state of Minnesota, for your policy to be compliant, you do need to break out cannabis now as a third category. So if you think about a company drug testing policy, generally it states, we will test for drugs and alcohol. If you find you're still able to test for cannabis products in the state of Minnesota, your policy needs to be updated to state that you test for drugs, alcohol, and cannabis products. If you don't break out cannabis from the definition of drugs, your drug testing policy is not compliant. So, can you test for cannabis products in the state of Minnesota? Well, it really depends. Again, if you're someone who is under federal authority like DOT, so FMCSA, FTA, FRA, FAA, those federal transportation agencies, for your employees that fall under federal testing, you still have to test for marijuana. But what about your employees that don't fall under that policy? So, sure, you can test your truck driver for THC still, but what do you do with your accounting group? Or what do you do with your customer service group? Can you still test for them? Well, within the law that was passed for Minnesota, there are some exceptions that are called out, that roles that you can still test for cannabis products legally within the state. The first is this law does define safety sensitive. This is important, and this is an asset for the state of Minnesota. There have been other states that have passed recreational marijuana and have limited employer drug testing, and they have not done any type of carve out. They have not defined safety sensitive. So within the state of Minnesota, under the law, safety sensitive is defined as a job in which impairment caused by drug, alcohol, or cannabis, again, breaking out cannabis from the definition of drug, usage would threaten the health or safety of any person. So as employers within the state, you need to do an assessment of all of your job roles. Do they meet this definition of safety sensitive? So again, if it's federal drug testing, you still need to test for THC. But if it's not federal drug testing, you need to take a look at your job roles. Does a mechanic that doesn't fall under DOT, is that considered a safety sensitive job function for your company? If it is, that role should be classified as safety sensitive, and everyone should know that that role is safety sensitive and subject to testing for cannabis products. There's more roles, though, that are excluded from this law. So we talked about safety sensitive functions. The law also states there's a group of employees that still can be tested for cannabis products as well, such as peace officers, firefighters, positions that deal with vulnerable adult populations or are in an educational space. Positions that still require a commercial driver's license but operate under a state authority. And again, they do call out, federal testing, so that this law does not, preempt federal testing for, marijuana, or if you're subject to a federal grant or you're a federal contractor, you would still most likely have to test for marijuana. So we're going to talk more about kind of what the roadmap is that you can follow to determine if you should still test for THC and how you do that. Now, the law also states, employers do not have to make accommodations for employees to use marijuana on the job site, to be impaired on the job site by marijuana, to allow them to possess marijuana or cannabis products on the job site, or to sell or distribute cannabis products on the job site. What these laws are really intended for is to protect the off-duty use of legalized cannabis products in the state of Minnesota. But that doesn't mean employers have to allow use while the person is on the job site. So as you take a look at your policies, if you are going to continue to have a stance on cannabis, whether it's testing, or even if you're going to remove cannabis from your drug testing panel and you still don't want to allow employees to have cannabis on company property, then that needs to be called out in your policy so that employees are aware of what your stance is. So as we take a look at it as well in the state of Minnesota, there are, within the law, it does talk about when employers can do reasonable suspicion testing, when they can do post-accident testing, when they can do random testing. Again, most of those are legal on safety-sensitive employees, or the exclusion classes we talked about. But there's still some other criteria in the law that's defined that employers need to be sure they're compliant with if they're going to do any type of testing for cause or suspicion, or having someone return to the workforce following use of a substance and going through some type of recovery program. So employees need to make sure that they're aware of those changes. So let's talk about now, how do you operationalize this? What is the path? What is the decision tree you can take to determine if you can and if you should and how you test for THC in the workplace? So step one, do an authority assessment. Take a look at your employees and determine, are you required to test under any type of regulatory authority, whether that's Department of Transportation, whether that's under Department of Defense, Department of Education, under the Nuclear Regulatory Commission, some type of federal authority, because if that is the case, any employee that falls under that federal authority, you still need to test for THC, because again, marijuana products at the federal level are still considered a Schedule I drug. Now, we might see that change in the near future. Just 2 weeks ago, Health and Human Services did send a memo to the DEA recommending that marijuana move from a Schedule I drug to a Schedule III drug. Now, that wouldn't take out marijuana from drug testing. It just moves it from there's no medical application to there's potential for medical application, and starts to allow the medical community to experiment with how marijuana might be applied in medical situations. That was a recommendation memo. No change has occurred. So again, if you have employees who test under a federal authority, you still need to test for THC. The other thing you need to take a look at is, are you a federal employer, or are you a federal contractor that falls under the drug-free workplace requirements of having drug testing and testing for THC? So you need to take a look at, do you have any type of federal contracts that may require you to still test for cannabis products? Then once you do your federal assessment, now it's time to do a state assessment. So you're attending our discussion today. That means you have a presence in the state of Minnesota. You need to understand the Minnesota laws with regard to employment drug testing. But what other states might you be testing in? So you need to kind of put a state map together. Do you have any employees who are located outside the state of Minnesota? Do you have any in Iowa, Wisconsin, the Dakotas? What are their drug testing laws that you need to be aware of? Do you have any more that are remote? Do you have any, let's say, in the state of California or Washington, whose laws are going to make it much more challenging to test in those states as of January of 2024? Do you have employees that travel through those states that you might be testing from? So might you have an employee attending a conference in the state of California, and are you going to have to drug test them possibly for reasonable suspicion or post-accident? Are you hiring someone in the state of New Jersey prior to them moving to Minnesota for their job. So if you're hiring the applicant while remote and testing in that state, you have to be aware of that state's drug testing laws, even if you're not located and that employee is not going to work in that state, because drug testing laws may be different while they're in and residing in that state. So kind of putting that map together, understanding the states you're going to be testing in. So you want to assess all the different authorities that might apply to your operations with regard to drug testing. Then the next step is taking a look at that state footprint. If you are a Minnesota employer and you hire within the state boundary of Minnesota, you have it fairly easy. These questions are fairly easy to answer because you just need to look at the law that was passed in May of this year and answer those questions based on that. If you're not solely in Minnesota, you are hiring from other states, or you may drug test in other states for different reasons, then it can become more complicated. So the first thing you want to do is ask yourself, can you test for it? So as we think about, in the state of Minnesota, let's say you don't have any federal authority that governs you with regard to drug testing. You test solely under your company policy. So you have to ask yourself, can you test for cannabis products? Well, the way to answer that is first, is there anyone on your staff who meets one of the exceptions outlined in the law that was passed? So do you have safety sensitive employees? Do you have employees that work with vulnerable adult populations, or are firefighters or peacekeepers, where the law still allows you to test for cannabis products? If the answer to no applies to all of those questions, then most likely you can't test for cannabis products in the state of Minnesota any longer. But if any of those are yes, then it's taking a look at who those populations are and how they're defined. Then it's taking a look at when you can test for it. So in some states, the reason for test plays a big part. State of California example, as of January of 2024, all drug testing that uses non-psychoactive metabolites, employers are not going to be able to use to make any type of employment decisions. In the state of Washington, however, that's only going to apply to pre-employment drug testing. So in the state of Minnesota, again, if you're solely in Minnesota, it's taking a look at what are the requirements with regard to reasonable suspicion, post-incident, and return to duty drug testing, and pre-employment, because the law does have specifics with regard to when employers can test under those reasons. Now, also in some states, reasonable suspicion criteria is now being defined, and it's not universal. As we take a look, Minnesota is different from California, different from New York, different from New Jersey. In the state of New York, it's very specific that the odor of marijuana cannot be used as criteria for reasonable suspicion testing. So you have to understand, if you are going to test reasonable suspicion, what criteria can you use or not use to make that determination? Then you need to take a look at, does the law talk about what you can test for or what you can use to make decisions? Again, I point to California and Washington. In California and Washington, the laws that are coming out in January state employers cannot make employment decisions, or in the state of Washington, pre-employment decisions, based off a test that looks for non-psychoactive metabolites. Well, urine drug testing looks at metabolites. That's what urine drug testing does. It looks for the presence of the drug after the body metabolizes it. There is no drug testing available today that detects impairment. So some drug testing, like urine, has to look at, did the body metabolize marijuana and there's presence of use. Oral fluid, on the other hand, which is another drug testing method, that will look for the parent drug before it is broken down. It still can't detect impairment, but it can detect the drug before the body metabolizes it into metabolites. So if you are testing in states of like California and Washington, Now this terminology becomes so important to understand how you can test and what you can look for. In the state of in Minnesota, the only thing that really is discussed, is cannabis products being broken out from the definition of marijuana. It doesn't necessarily go down to the metabolite level, but some states do. And if you're testing in those states, you have to understand what you can test for and what you can't test for. Then you have to take a look at, within the states you're going to be testing for, can you take action based on the test result? So do you need to make accommodations? So, if does the state have a law that requires you to do some type of accommodation with the employee to accommodate their medical marijuana use? Doesn't mean you have to accommodate using it during working hours, but you have to accommodate it in their off-duty hours. So you have to understand if that applies as well. Once you do your assessment, once you take a look at the authorities that apply to you, now it's putting it into practice. So if you decide that, let's say you are in the state of Minnesota, you do have safety sensitive employees that you believe meet that definition, you know which roles meet that definition, now you're going to continue testing for THC. How do you do that? Well, first is taking a look at, are you testing solely in the state of Minnesota? Or do you have employees that are located throughout the country? If you are testing solely in the state of Minnesota, you have it much easier. If you have employees that are located across the country, you have to determine, are you going to handle all those states individually or globally? So if you have, employees that test in Minnesota, Wisconsin, and California, are you going to test them all according to that law, which means in Wisconsin, you can test for THC. Minnesota, you can only test for it if it's safety sensitive role. And in California, as of January, you're not going to be able to test for it using urine drug testing. You may have to consider other methodologies. Or are you going to say, we test in many states, we're going to go with the most conservative approach, which is California, which means we're not going to test for THC. Every employer handles this differently. There's not a cookie cutter approach that can apply to all employers. You have to take a look at your industry, you have to take a look at your risk model, and you have to take a look at the job function that the employees do. Are they safety sensitive? Are they a threat to the public, to the other employees, if they are under the influence of cannabis products? Once you determine how you're going to handle multiple states or the state of Minnesota, then you need to determine if you're going to test differently based on test reason. So are you going to, in the state of Washington, maybe not test for pre-employment, but you're going to test for random reasonable suspicion in post-accident? Or are you going to test the same regardless of the reason for test? And do the states allow for that? If you're going to be an employer that tests for marijuana sometimes or in some locations, but not all the time, you need to have a process in place to manage when the wrong panel is selected. What do I mean by this? Let's say you are an employer in the state of Minnesota and you have a group of employees you deem is safety sensitive. Let's say they're your mechanics. Then let's say your accountants are deemed not to be safety sensitive. What happens if one of your accountants goes in, let's say for a pre-employment drug test because you want to hire them on, and the clinic accidentally runs a panel that includes THC and they shouldn't have been tested for it and it came back positive? Do you have a process in place to catch that the wrong panel was selected at the clinic prior to that result being reported out? Often, this is working with a service agent like Vault, whose MRO may catch that and be that safety net for you, because you don't want to take action on it when you shouldn't have been testing for it. Then, as you take a look at medical use, you need to determine as an employer if you're going to attempt to validate medical cards. What we do see is employers believe that they do need to validate that the medical card is legal, valid, current, and this is a challenge. The use of medical marijuana is a referral. It is not a prescription. What do I mean by that? Well, a medical review officer, when an employee has a drug test and it's positive for, let's say, hydrocodone, that medical review officer can contact the Walgreens, the CVS, the Rite Aid, the pharmacy that issued it, and they can validate that there was a valid prescription, there was a valid fill date, and it all complies. That's not really available when it comes to medical cards. There isn't that infrastructure in most scenarios where a medical review officer or an employer can actually validate that the medical card is legitimate. Some states, medical cards expire. Some states, they don't expire. Some states allow reciprocity between the states, some don't. So if you're going to try to attempt to validate the medical card, you need to have an operational procedure how you're going to do that. What are your thresholds? What is your process going to be? What happens when you can't validate it? Because most states don't have any type of clearinghouse you can check. So are you looking at it just based on image? Or are you taking the employee's word for it that they have a medical card and leaving it at that? Once you decide what you're going to do, whether or not you're going to test for THC, whether or not you're going to test for it across your entire employee population or remove it from your entire employee population or test for certain populations, you have to take a look at your drug testing policy. You need to make sure that your drug testing policy reflects your views and your rules around the use of cannabis products in the workplace. So even if you're going to remove cannabis products from your drug testing panel, you want to make sure that your drug testing policy doesn't state you're going to test for marijuana because you've actively now chosen to remove it. Or if it's going to be tested for certain employee populations, you want to make sure that your your policy states you test it for safety sensitive or what roles still receive testing. And in the state of Minnesota, it's important that you break out cannabis products from the definition of drug. So again, if you find that you do have roles within the state of Minnesota that are part of the exceptions list, you state that you're going to test for drugs, alcohol, and cannabis products. Updating your drug testing policy should never be taken lightly. Whenever you update your drug testing policy, you should review it with your legal counsel to make sure that it does meet all of the state laws and federal laws that may come into play. When you do update your policy, you want to make sure that you get it out to your staff, that they have time to learn it, read it, be trained on it, some type of notification that can be tracked that your staff has received it so that they know of the change, so that if there is a issue down the line, you can point to when John or Sue or Bill was told about the change in testing policy, that they should be aware of what can and cannot happen at the workplace and what does it mean when it comes to drug testing. All right. I want to thank everyone for letting me walk through that. I do see that there are some questions that have come in. So if you do have some questions, please feel free to drop them in the Q&A feature, and we will go ahead and take care of answering some. So the first question, there's a lot of details for employers to worry about. We haven't created a third category for cannabis testing. What are the risks of being non-compliant? It's a good question. So, it's each state handles it differently. So it's, taking a look at the state law to determine what non-compliance means. It could result in things such as, a discrimination in employment based on how, it would come to bear. It could result in, legal cases. If it is something, that happens enough, it could, bring oversight in. So, this shouldn't be taken lightly. So employers really need to understand, again, the states that they're testing in, because each state handles it differently. Some states there is the right of private right of action. Some states it might be going through the state AG's office. So it's going to be different, based on the jurisdictions that you're testing in. Next question is, if we have a combination of regulated and non-regulated employees, what do you recommend doing for testing? This is probably one of the most challenging situations for employers to figure out. I'm a trucking company and I do have commercial drivers. I have to test them for marijuana. But what do I do with my non-truck driving employees? Or what happens if I want to test that truck driver, but I want to test them under my company policy, which is different from DOT requirements? It starts with making sure employees understand what policy applies to them. So it's making it clear that based on the function that they do, their job role is subject to DOT drug testing. Their job role is non-DOT safety sensitive and subject to THC testing. Their job role is non-safety sensitive, non-regulated. We are not testing you for THC. It's making sure that your HR department or your recruiters, whoever is responsible for defining your job roles, it's clear what drug testing policy applies to it. And if you create new roles or change roles, it's doing that assessment. What drug testing policy applies to this role? And it's making sure your policies are clear which policy applies to what role. Next question. Can I talk about oral fluid testing? We're not a DOT company, but it seems a better experience, less invasive. Good question. So oral fluid testing is, testing where a swab is placed in a donor's mouth. It captures saliva and is then sent to the lab. So as you think about traditional drug testing, it's a pretty invasive process. A donor is asked to provide a urine specimen. They have to go into a restroom and provide it. They're in that restroom by themselves providing it in most situations. Sometimes they're observed, but the chance to cheat on a urine drug test is much higher than an oral fluid test. If it's observed, it can be very invasive to have someone in a restroom watching you urinate into a specimen cup. Oral fluid testing is much less invasive. It doesn't require the restroom. It just requires a space that is private that the collector and the donor can step off to the side and do a collection that no one else can get in the way of that collection occurring. All oral fluid is observed. The collector stands in front of the donor while the oral sample is collected. The swab is taken from the mouth and put directly into the cup or into the vial that's sent to the lab. Urine testing, the collector has to take, the urine cup and then pour the urine into 2 vials. So it's just a much less invasive process for all parties. DOT did approve oral fluid testing. It went into effect in June of this year. It is not ready operationally. There are 2 labs that are required to go through the National Lab Certification Program first. But once we have 2 labs up and running, oral fluid testing is going to be available to all DOT agencies. So it's a much better experience. And it's not one or the other. You can take a look at your drug testing program and decide, I'm going to test urine in these cases. I'm going to test oral fluid in those cases. Or I'm going to test urine, but if the employee can't provide enough urine due to a medical condition, I can then do an oral fluid test. There's some differences in detection windows. Oral fluid does pick up drugs faster. Urine takes longer to detect it, but urine detects it for longer than oral fluid. Oral fluid's like a 36 to 48 hour window. Next question. We haven't updated our drug testing policies this year. What are 3 things I need to tell our senior leadership to do ASAP? So there's no requirement how often you have to update your drug testing policies. We recommend you take a look at your policy on an annual basis. There's enough changes going on with regard, especially with regard to marijuana testing, that your policy is kept up to date. Or if you've added new job roles, making sure you understand what drug testing policy applies to those job roles. So the first thing I would say is you need to sit down with senior leadership and talk about what is the company stance with regard to THC. Does a company still want to test for it under company policy? Do you have the roles that you can test for it if you take a look at the state of Minnesota? What is your risk threshold? Doing that assessment, you want to have senior leaderships weigh in and buy in there because they're going to be the ones that help push this across the entire organization. Then it's asking for the resources. It's the resources to take a look at your company policy. Do you partner with a company like Vault to actually review your policy for you? Do you partner with a company like Vault to help you come up with the processes you need to put in place? And then it's taking a look at, making sure you have legal availability to review your policy once it's finalized. And then third, it's talking about the resources to train your employee population. What is the company's stance with regard to the use of drugs and alcohol in the workplace? And now, more importantly, on the employees' off hours that may have an impact during working hours. What is that? How does the employer support individual protections for off hour usage? But what are the requirements when the employee is on the job site or on company time? Those are the big 3, I would say, to pull senior leadership in on. All right. Looks like we've gotten through all the questions. I can wait a minute here. Otherwise, I can turn it back over.
Yes, that's it for everyone. Thank you so much, Sean. That was wonderful. Lots of great information there. Thanks for joining, everyone. Have a great day. Bye-bye.